those with pre-existing conditions. This is very, very important news. And we plan on being among the leading states in rolling out the highly effective booster, which will do two things. On the personal level, help provide another 5-10% of protection for those who need it, even more for those who have lapsed some period of time since their first two shots. Secondly, it will give us better control of the virus, because again, the 0 to 85 ounces more, but 85 to 90, 85 to 95 is also worth something at the population level in terms of reducing spread of the virus. So we're excited about it. We're ready to go. You'll hear about our plans today. First, an update, 1,394 new cases. Of those, only 278 were vaccinated individuals. And again, not only does the vaccination significantly reduce your chance of contracting the virus, but it also makes it much more likely that you will have a minor case and not require any form of hospitalization. We have 224 ICU beds available, a higher number, but we also have 914 hospitalizations. That's 19 more than yesterday due to COVID. Again, to put things in perspective, out of the 914 people hospitalized with COVID, 155, only 155 are vaccinated. So well over 700 are unvaccinated. And the average age of those who are unvaccinated, who are hospitalized, is in the low 50s. Those who are vaccinated and hospitalized is in the mid 70s, which again speaks to the need to get the booster to those in their 70s and 80s. We only have 16 kids vaccinated. 10 are age 0 to 11. 6 are age 12 to 17. Again, I'd point out there's not any reason to have anybody 12 to 17-year-old hospitalized for COVID, because the vaccine is available for kids age 12 to 17, and it shows even higher efficacy, really approaching 100% effectively for that young cohort of 12 to 17-year-olds. So it's sad that there are 6 12 to 17-year-olds hospitalized, because that should be 0. There are 10 0 to 11-year-olds. We hope that the vaccine will be approved for that cohort shortly. We certainly hope in October. It's too early to say whether we are stable or on a downward trend yet. We're certainly showing some degree of stability these last few days, but I think we need a few more days data to say, is it still on a slight increase? Is it stable? Or is it a slight decrease? We certainly hope it's a decrease, but if hopes were nickels, we'd all be wealthy now by the end of this pandemic. So we'll watch the data the next few days. We'll report out to you exactly what happens. There's still a high level of community prevalence. I encourage everybody to remain careful. Wearing masks around a lot of other people indoors is a good idea. Most of all, if you haven't been vaccinated, please start the process of getting vaccinated. And you'll hear us talk about the booster. If you are 70, 80, if you have some weakened immune system, please go ahead and get that booster today. You can show up at your local pharmacy, doctor, and just specify that you have a weak immune system, and they should be able to give that to you. You've heard a lot of talk about the boosters and third doses over the last few weeks, and I'm glad that already many of Coloradans most at risk and elderly and immunocompromised are getting that protection. A third dose allows older Coloradans, those who are immunocompromised, to get the same level of protection that 20-somethings and 30-somethings have with the 2 doses. In mid-August, the state of Colorado advised vaccination providers to offer the third doses to really anybody who asks, who says that they're immunocompromised or has a weak immune system, really breaking down any barrier to getting that third dose. We made it so Coloradans could simply self-report their conditions. You don't need to have a doctor in the middle of it. You can, your doctor may give you a note, but you don't need to. You can simply say, I have a weak immune system, and and therefore you need the shot. And we now have 2.4% of adults who've got a third dose, including my 77-year-old parents, and I'm very grateful for that. And we even recommend that providers, and I know that UC Health System is doing this, reach out to their older patients and those with immunosuppression to encourage them to get that third dose, to get that higher level of protection. And we're working closely with our long-term care facilities to vaccinate their immunocompromised residents. You'll hear about our large-scale nursing home vaccination plan to begin September 20th. For those who receive the Pfizer vaccine, which is effectively everybody in our nursing homes. If you recall, the Pfizer vaccine was available earlier. We prioritized nursing homes earlier. So nearly everybody in our nursing homes was administered the Pfizer vaccine. The early data shows that the booster shot is even more important, or perhaps you could say it's needed even sooner, as in 6 months, 7 months, for those who got the Pfizer vaccine. The Moderna vaccine is thus far showing longer enduring protection at a higher level, But that doesn't mean that you wouldn't benefit from a booster shot if you are elderly or certainly have an immunocompromised condition. At any age, you should get that booster shot. We are at 72,957 Coloradans have gotten their third dose. That's about 2.4%. We'd love it to be higher. We hope that it will get higher, especially as we roll out these plans, but a lot of that is up to people's decisions, and we hope that people go ahead and get that. And this is really the next phase of adding an additional level of protection against the virus, both at the individual level to give that person a higher degree of protection, but also at the population level, that also helps reduce spread. Again, not as much as those first two shots. So important. If you haven't gotten any, please do. But to get that extra peace of mind and a higher level of protection, I do encourage elderly Coloradans who generally have weaker immune systems, those who are immunocompromised, to go ahead and get that. Just last week, President Biden told the nation the federal government is ready to distribute as soon as the FDA and CDC give final recommendations and approval. We are still expecting that for Pfizer, September 20th. If for some reason it comes a few days or a week or two later, our plans will obviously shift accordingly, but we really hope it doesn't, because every day that goes by leads to unnecessary hospitalizations and loss of life among our most vulnerable while we wait and are ready to administer the highly effective COVID booster vaccine. To speak in more details about our efforts to provide the booster more widely, I'll turn it over to Scott Bookman, COVID-19 Incident Commander. Scott, over to you.
Thank you, Governor, and thanks to everyone for joining today. Here is a map showing all of our enrolled COVID-19 vaccine providers across the state. And I'm proud to show here that every single county in Colorado has at least one vaccine provider in their county. Our work over the last 9 months to get 75% of eligible Coloradans receiving their first dose has truly been a remarkable effort and a remarkable partnership between all of our providers. Retail pharmacies, our large health systems, our federally qualified health centers, our primary care practices, providers across the board who have stepped up and ensured that Coloradans have access to this life-saving vaccine that is helping us end this pandemic. Now, we still have 25% of the eligible population who has not been vaccinated. As the governor said, as I have said, as Dr. Hurley has said, we cannot overemphasize the importance of this vaccine, how safe, how effective, and how it is the key to us ending this pandemic. We will continue to do all that we can to move that 25% number smaller, to get those who are hesitant to get this safe and effective vaccine. Simultaneously, we have been preparing for months for our booster campaign to begin. This will include plans for the general population, along with specific clinics for our underserved communities, like we did the first time around. So this will include our essential frontline workers, our other underserved populations, making sure that our educators have access to the vaccine in a way that is easy for them. We really want to make sure that all Coloradans have the ability to get this booster when it is their time to get it. Next slide, please. And so to that end, we have been doing an analysis of kind of our peak administration of vaccine, along with estimates that have been provided to us by our large providers. And so here is our analysis of the total capacity per week in Colorado to provide vaccines. And so our 5 largest retail pharmacy chains can provide over 100,000 doses per week. All of our other remaining providers, and again, that's smaller pharmacies, it's clinics, it's our large health systems and our own work at the local and state public health level, can deliver over 530,000 doses per week. So that's a total capacity of almost 650,000 doses a week and 2.5 million doses per month. We hope that we have that level of demand in Colorado, and we are here to serve it. Now, We know that this is going to be a big effort throughout the entire COVID response. We've been grateful to have the incredible partnership of our partners at the Colorado National Guard. And I'm proud today to introduce to you Lieutenant Colonel Jamie Pieper, who will be leading our Joint Task Force vaccine into the next phase of this campaign.
Thank you, Commander Bookman. So just like our original vaccine distribution plan, our booster planning focus started with our most vulnerable population, the residents and staff of Colorado's long-term care facilities. That's 1,098 facilities, and those include our senior living facilities, our assisted living facilities, and some HUD housing and independent living locations that we assisted with last year. So last year, the federal government contracted with the retail pharmacies, CVS, and Walgreens to vaccinate our long-term care facility residents and staff. This year, the state is partnering with our enrolled providers to ensure booster offerings at these facilities and that the state has oversight of that process. We have moved forward with our planning, knowing we may need to adjust our timelines based on that formal approval from the FDA and recommendations from ACIP. So pending ACIP recommendation, Colorado long-term care facilities will offer a booster clinic for their residents and staff between the 20th of September and the 11th of October, not later than the 18th of October. The CDPHE staff is currently working with each long-term care facility to ask about their preferred provider of choice so that we can help ensure that scheduling happens. And then for any of our long-term care facilities that need a provider, CDPHE and the state are going to ensure that we provide that service. We're also happy to offer the vaccination convenience to long-term care facility residents and staff who need that first or second booster or vaccine dose. So our booster planning also includes offering booster clinics to the 1,238 community-based organizations who offered second dose vaccine clinics, as well as worksite-based booster clinics for our frontline essential workers. Next slide. So to show you some of the numbers that have really gone into this strategic booster planning, we've assessed 4 different scenarios as we've looked at booster planning in Colorado. We considered both a 6-month and an 8-month interval from the date of the second dose to that date of the booster dose. And then we also looked at the anticipated demand. So how many eligible Coloradans would want to get their booster dose? And we assumed 100% of the eligible population would be eager to get that booster dose. And then we also looked at what that would be if 75% of the population decided for that booster. So just for your awareness, the CDC estimates that 75% of those individuals who got their second dose of vaccine would go on to get their booster. But for Colorado, we're being more aggressive than that 75%. We believe more Coloradans will want to get the booster. And so we've utilized the most aggressive planning scenario, which is looking at the numbers you see before you, which assesses for Coloradans who received their second dose 6 months after. That's when we're looking at making sure that they would have that opportunity to get their booster. And we're assuming that 100% of that population would like to get their booster. So in other words, we think that we are ready to provide more boosters than the CDC thinks that there will be the demand for. That line across the top there, that total weekly capacity, is the number that Commander Bookman referenced, that based on feedback from our providers throughout the state, that is the weekly dose capacity that our providers can offer. And so as you can see here in this chart, anticipated booster demand is much less than the capacity that we're able to provide. Next slide. This chart shows for those Coloradans who received a second dose of the vaccine and would be eligible for their booster 6 months after, and that window falling between June and September of this year, anticipating we need that approval for the booster before they could actually come get that shot, assuming that they're not immunocompromised. How would those numbers flow into the first month? So the last 2 weeks of September and the first 2 weeks of October, so that we could also ensure appropriate capacity so that those individuals could get their boosters. So that row across the top there shows the numbers that we looked at the previous chart. The general population that's due for a booster at 6 months, we're assuming 100% of eligible Coloradans will get that booster. The second row shows for our unvaccinated population, which is currently about 1.2 million individuals, we're assuming that 50% of them would like to get their first dose of this life-saving vaccine over the next 4 weeks. And then that third row shows the breakout of the individuals that would be booster eligible between June and September of this year, and assuming that then they're able to get their booster after the 20th of September. So you'll notice there in the notes, it just indicated there's a minus 75,000. The reason for that is because that is the number of staff and residents at our long-term care facilities that we'll be ensuring have those on-site clinics. And so that would not be impacting the overall capacity for the rest of the state. So overall, you see the numbers there across the bottom. That's the anticipated demand based on general population, unvaccinated population. And you can see that those numbers are far below that 645,747 weekly dose capacity here in Colorado. So as you can see, Colorado is in a great place as we await the FDA and CDC's announcement on who gets boosters and when those populations are eligible. Colorado is ready. Now I'll turn it back over to Governor Polis.
Thank you, Lieutenant Colonel Pieper. So just to summarize, and I want to be clear, it doesn't mean that we are expecting 100% of people to get it on that schedule or even the 50% of the unvaccinated. We just want to be ready. But it could get harder for a week or two to get that booster than it is now, and then it will be later. Why? Because it will just be Pfizer, September 20th is what we're hearing. Moderna could be a couple weeks later. Not every site offers Pfizer. It will stretch our capacity, especially as many employers have also required a first dose by the end of September. We want to show that we're generally ready. I wouldn't be surprised if there is a week or two where it might get a little harder. Doesn't mean impossible. Like, it's not like the early days of the vaccine. You probably will be able to find it, but it might not be at your local doctor, your local pharmacy. It might be, the next town over, 2 towns over. But that will end after a week or two of that initial rush. But you can beat the rush for your booster now if you have a weak immune system, are older and have a weak immune system. You simply say that and you can get it. There's plenty of openings right now to get that booster, especially if you got Pfizer and especially if it's been 6 months since your first dose, second dose, that is recommended. So we are getting ready for this. And as I said, we don't expect to hit these numbers. These are not goal numbers to hit. They are operational numbers to be ready for. And I'm comfortable that we will be ready. Even with these numbers, there could be some regional pressures and small delays in getting that booster of a week or two, but those should be resolved relatively shortly given our overall capacity as well. This is truly a pandemic of the unvaccinated. If we had 100% vaccination, there'd be negligible hospitalizations, negligible community spread. The reality is that there's enough hosts that are unvaccinated for the virus to continue to replicate, largely infecting unvaccinated people. But unfortunately, because the vaccines are 85% effective, 90% effective, it affects a few vaccinated people as well. I want to reiterate that Colorado has the resources, the infrastructure, the plan to continue to offer the vaccination to those who are unvaccinated, while also offering boosters to those who want it as well, very aggressively. I would like to see that 2.4% number increase over the next couple of weeks to get more out of the way for when the larger group comes with Pfizer September 20th and a few weeks later with Moderna. We've learned a lot this last year. Just like the early days of vaccine distribution, it requires meticulous planning ahead of time to make sure that we can offer the people of Colorado this free, quick, easy level of protection. And we're excited to be ahead of the curve and getting ready to roll out the booster to a larger population, as well as to continue to meet the needs of those who want a first or second dose. Thank you. And with that, we'll go to questions.
To all members of the media, please state your name and affiliation prior to asking your question. The first question goes to Vinny. Go ahead, Vinny.
Yeah, hello, Governor Polis. This is Vinny Del Giudice at Bloomberg News in Denver. As you gear up for the boosters, has the state identified any new mutations? And also, is there any sign that the surges we're seeing in the border states are affecting border areas of Colorado? Thank you very much.
The vaccines remain highly effective against every known mutation of COVID-19. The prevalent mutation of COVID-19 in Colorado is the Delta variant, representing in excess of 98% of cases in our state. And while Delta is more transmissible which means it is more transmissible among the unvaccinated and vaccinated, the vaccine still offers a very high level of protection. It's just that the base virus is simply more transmissible, representing an additional danger for those who are unvaccinated. What was your second question about the border?
Yes, we're seeing some pretty severe outbreaks, surges in Utah, Wyoming, all the border states. Has there been any evidence that that's crossing over in the border areas of Colorado? In other words, are you seeing more problems in the border areas?
Yeah, well, we're always concerned with reintroduction of the virus and variants to our states. So when the virus was spiking, and it still is in the southeastern United States, there's obviously less everyday travel between the Southeast United States and Colorado as there is between Utah and Wyoming and our neighboring states. So of course, we have a heightened level of concern about spiking virus levels in neighboring states. But we have a high level of the virus here, even though it's one of the lower states. So we encourage people to take the right precautions, regardless of whether they're interacting with somebody from Utah, Wyoming, or within Colorado. And that includes, of course, wearing masks in large groups around others, especially indoors. Smart thing to do. And most of all, go ahead and get vaccinated if you haven't yet. It's available. It's a triumph of modern science. It offers an extremely high level of protection.
Thank you very much, sir.
Our next question is from Meg. Meg, go ahead.
Hello, this is Meg Wingeter from the Denver Post. I just wanted to clarify about the mechanics, if you will, of distributing these boosters. So it sounds like for nursing homes, they're going to have a greater variety of partners. But for the general public, is it basically going to accept not having those, kind of mass vaccination sites that were a bigger feature earlier in this?
Yeah, that's a great question. So yes, there's two different things. We have to have the proactive plan, just as we did in partnership with the federal government, to hit the nursing homes where they are in each nursing home. And that's what Jamie and Scott talked about, to make sure that everybody who, and they all essentially got Pfizer initially, everybody will be offered that booster. And these are folks in their 70s, 80s, 90s, and remain the most vulnerable to the virus, and remain also have less stable antibodies over time than younger, healthier populations. So that's very important. For the general population, it is available the same ways that the first two courses of the vaccine were, which means pharmacies, hospitals, drive-through sites, doctors. At this point, there will be plans for small to mid-scale drive-through sites in major metropolitan areas. If needed, we will go to larger scale, but we think that we can have a series of small to mid-sized ones. And then we've worked on our capacity with the pharmacies, Safeway, King Soopers, Walgreens, et cetera, to make sure that they can hit those numbers that were in the plan that Jamie and Scott talked about with regard to making sure that people's needs are met.
Thank you.
Our next question is from Jackie. Go ahead, Jackie.
Hola, gobernador, habla Jackie López de Telemundo. Me gustaría saber que mientras los esfuerzos para la vacuna, para vacunar a todos en la comunidad están continuando, si tienen un plan para proteger a los trabajadores de las clínicas de incidentes de acoso o ataques como los que se han reportado en el condado Jefferson. Muchas gracias.
Estamos usando la policía local y también la policía del estado para proteger a todas las personas quien quiere recibir la vacuna. Y este es muy seguro ahora y vamos a proteger todas las locaciones que ofrecimos el vacuno.
Our next question is from Chris. Go ahead, Chris.
Chris Vanderveen with 9 News. Governor, I want to ask you about just this morning, an article came out in the Lancet that was signed by a number of scientists that mentioned, quote, current evidence does not therefore appear to show the need for boosting in the general population in which efficacy against severe disease remains high. What are your thoughts about this sort of mixed messaging when it comes to booster shots? Some people say it's necessary to get us out of this, and some people think it's wrong for us to do this moving forward.
Well, first of all, we can all celebrate the news that Marion Gruber and Phil Krause have left the FDA in disgrace over unnecessary delays for the booster. They have blood on their hands, and there are thousands of Americans that are dead today because of their delays of the booster shot. What the article shows is, of course, the truth, that the first two vaccines are highly effective at preventing severe cases. But what we were finding is two things. At the individual level, we still have 150 people who have received both vaccines who are vaccinated. If the booster shot had been administered a month or two ago, that number would be much lower. A number of studies show it increased the efficacy of the immune response, especially for those in their 70s and 80s and 90s, especially for those with immunosuppressed conditions. So the delta, the change, is significantly smaller than the protection that the first two vaccines offer. But at the very least, the FDA should get out of the way and allow people to make this choice to protect themselves. It's a choice that my parents made. It's a choice that many of their friends made. It's a choice that many well-educated Coloradans have already made. But for us to continue with our equity efforts around making sure the booster shot is widely available, we simply need the FDA to get out of the way and allow us to proceed with protecting more Coloradans. Again, the Lancet article shows at the population level that the two courses of the vaccine are effective at preventing the most severe consequences of the disease. It also acknowledges that a booster shot can be effective at preventing a higher number of mild to moderate incidences of the disease, which is important for two reasons. One is, while of course the biggest goal is to keep people alive and out of the hospital, it does us good as a society from a public health perspective to reduce the number of mild to moderate incidences of the disease even further, because all of those can potentially spread the disease. And secondly, some percentage of those mild to moderate incidences do develop into severe incidences, a much lower percentage with two vaccines, but an even lower percentage with the booster vaccine. So I'm thrilled that the Biden administration is still on track for rolling out the Pfizer vaccine for larger use for the booster on September 20th. I'm hopeful that the Moderna vaccine will be approved shortly thereafter. To emphasize what the data shows, which is generally and broadly consistent with all the studies that have been done, it is more important for recipients of the Pfizer vaccine to receive their booster shot sooner, as soon as 6 months after their last shot. It is more important for people in their 60s, 70s, and 80s, and those who have weakened immune conditions of all ages to get that booster shot. But there is some advantage for all cohorts in receiving that. The benefits outweigh the costs overwhelmingly, and the FDA needs to get out of their ivory tower and realize there's a real-life pandemic with 900 hospitalizations in Colorado, tens of thousands across the country. We have the ability to end it. We need to show the will to end it. And while the two-course vaccine is the primary tool to do that, there's an added benefit to the booster shot. Thank you.
Our next question is from John. Go ahead, John.
Governor John Daly, Color Public Radio. Is it your understanding that there would be a need for more boosters beyond this third one down the road? Is this something that could be an annual thing, or is the data still not available yet?
No, there's no data on that because the virus hasn't been around long enough to know. No data has showed any waning immune response yet from the third booster vaccine. There are types of vaccines that people get once a decade. There are types that last the whole lifetime. There are some that you have to get on a regular basis. This virus simply is a novel coronavirus, and there's simply no real world data about how long the antibodies from a third booster shot last for, and whether they are permanent or whether they also wane in, a year or 2 years. There's simply no data on that because the virus hasn't been around long enough.
Our next and final question will be from Univision. Go ahead, Univision.
Hello, Governor. Jesús Carrasquel from Noticias Univision. Gobernador, en otro tema, ¿puede decirnos cuál es la importancia del crédito tributario por hijo para los residentes de Colorado y si los inmigrantes indocumentados podrían tener acceso? Gracias.
Lo más importante es que sacar a familias de la pobreza y añade dinero para asistir a sus familias. La Child Tax Credit ampliado reducirá la pobreza infantil en Estados Unidos, sacará de la pobreza 57,000 niños en Colorado, beneficiará del dinero. La expansión tendrá un gran impacto para mejorar las vidas de nuestras familias. Los niños documentados con un número de seguro social pueden recibir el beneficio. No se importa el estatus de sus padres, y es muy importante saberlo, y queremos tener una conversación con la comunidad latina cómo puede aplicar para ese dinero. Porque si un padre es ciudadano, es muy fácil, pero si el niño es ciudadano y los padres no son ciudadanos, todavía es posible. Y vamos a explicar toda la información con una persona de nuestro departamento de Revenue, quien habla español muy pronto.
We have one more question from Julie Martin. Go ahead, Julie.
Yes, this is Julie with KKTV. I was just curious. We've seen reports come out this morning that children could possibly have that vaccine by Halloween. What kind of impact do you see that having on the state? And do we have availability for those children to get the vaccine?
Yeah, and by the way, another area of frustration with the FDA is the lack of guidance with regard to those who receive the Johnson & Johnson vaccine. They need to get off their rear ends and provide that guidance. There are many people who received it who on their own are beginning the course of 2 vaccines with the Pfizer and Moderna. But again, there's a inhibition to that at the because of the lack of guidance. So they need to do that. They need to get the booster out. They need to get the kids' vaccine approved. And they need to tell people who got the Johnson & Johnson how they, if they choose to, they can increase their protection level. So children, children have a much lower health risk from this virus. As an example, we have, 15 kids hospitalized in our entire state. But obviously, as a parent, you want to protect your kids even from viruses that can cause some degree of illness. And I want to protect my kids who are 9 and 7. They recently announced that Pfizer would be submitting the data by the end of September, I believe in the next week or two. Assuming that data is compelling, I would call upon the FDA to act urgently and expeditiously, considering the ravaging effect of the epidemic across the entire country of the pandemic. And hopefully that would mean that they would act in October on that data to approve the vaccine for those who are 5 to 11. And my kids will get that as soon as it's approved. Thank you so much for joining us. Very good discussion about the vaccination plan today. And just to put things in perspective, there's a lot that President Trump got wrong about the pandemic, but there's also something very important he got right. And what he got right about the pandemic was Operation Warp Speed. The FDA would have sat on and delayed the life-saving vaccine for many more months at the cost of tens or hundreds of thousands of American lives had he not acted to reduce the bureaucracy and paperwork and make the life-saving vaccine available quicker, including ordering it before it was even approved in preparations to administer the American people. This is a moment where similar leadership is needed by the Biden administration to make sure that the FDA does not succeed in using ivory tower circular reasoning to further delay the life-saving booster, or assuming the data is strong when it's presented by Pfizer, the availability of the vaccine for those that are age 5 to 11. Thank you so much. Take care.